And it's Thursday, right? 10 a.m. tomorrow. You're in the future.
Yeah, the 2nd December. Yes.
And it's Thursday, right? Okay, we are live right now. Okay, 7 on the dot. Let's start. So hello, everyone. Good evening. My name is Nicole Alvarado, and this is my co-host, Catherine Mucio. We are fifth-year students of veterinary medicine in the National University of Costa Rica. It is an honor to have Dr. Matsura with us today. As we know, his schedule is profoundly busy. A brief introduction of Dr. Matsura and his work. He was born in Japan in 1989. He got his DVM in 2013 in Japan too. From 2013 until now, he has been working in the VCA Japan Shiraishi Animal Hospital located in Saitama, Japan. He was board certified member of the Japanese Society of Veterinary Cardiology in 2020. His research experience goes from 2016 to 2020, where he got his PhD in veterinary medicine, a doctoral course of United Graduate School of Veterinary Sciences. And from 2020 to now, he is a postdoctoral researcher in the Department of Veterinary Surgery in Tokyo University of Agriculture and Technology in Tokyo, Japan. We now open this space to the doctor for his presentation, and we would like to remind the audience that we have 15 minutes for questions at the end of the talk. You're encouraged to write the questions in the chat and we will read them. And if you prefer to ask in Spanish, we will gladly translate. Si ustedes prefieren preguntar en español, nosotros traducimos con todo gusto al doctor. So doctor, we are all yours.
Okay. Thank you for introducing me. And I'd like to thank you for the opportunity to give this presentation today. I'm Katsuhiro Matsura, a Japanese cardiologist and a cardiac surgeon. Mitral valve surgery is becoming increasingly important. It deals with primary mitral valve disease. This disease is, of course, not only for Japanese dogs. So my life work is to make sure that the patient who want this surgery can get it anywhere in the world. Today, I'd like to share you some of our work. This is a model of the heart. Normal heart here, blood flows from the left atrium to the left ventricle through the mitral valve during diastole. And during systole, the blood is ejected from the left ventricle into the aorta and to the systemic organs. In diseased heart, the rupture of chordae tendineae of the mitral valve causes the blood to flow back during systole. This causes enlargement of left atrium, and in severe case, triggers pulmonary edema and leading to dyspnea and death. This is from American College of Veterinary Internal Medicine Guideline, Consensus Statement Guidelines 2019. The description of surgical intervention of mitral valve disease first appeared in these guidelines. So now, the surgical treatment is indicated for dogs with the various stage dogs in this disease. I think this indicates the transition from traditional medical treatments to curative surgical treatment. The panelists of this guideline emphasize that surgical facilities are limited. So the mitral valve repair at the few centers, demonstrating evidence of acceptably low complication rates and effective and durable results. Despite the great number of needs, the benefits of surgical treatments are currently limited to a small number of cases. One of the factors that makes this surgery in limited facilities is the difficulty of cardiopulmonary bypass technique. It is essential for this surgery and requires heart to stop during the procedure. This is a schematic diagram of extracorporeal circuit we are using. The blood is removed from cranial vena cava to the venous reservoir, and then go to main pump tube and artificial lung, and finally they go back to the carotid artery. And this disease is common in Chihuahuas and weighs only about 3 kilograms, which is the same as a newborn baby. Therefore, various techniques similar to those of pediatric heart surgery is applied. A hemoconcentrator, which is our alternative to the kidney function, we can perform ultrafiltration and hemodialysis by using this hemoconcentrator. And one of special technique is modified ultrafiltration. This is used in a pediatric field. Modified ultrafiltration is the method of concentrating blood after the end of bypass circulation by using hemoconcentrator. As shown in the blue line, the blood dilution by use of cardiopulmonary bypass usually persists after the end of the bypass. On the other hand, performing the ultrafiltration procedure made almost no difference before and after the bypass in hematocrit value. So ultrafiltration can minimize anemia and coagulation abnormalities associated with bypass. The next procedure is the intraoperative hemodialysis. Many dogs with mitral valve disease are taking diuretics, so it's very common for them to have azotemia at the time of surgery. The baseline preoperative blood urea nitrogen is about 50 or 60. The reference range is about 10 to 30. So they have azotemia. And this pre-operative renal damage increase the risk of post-operative acute renal failure. So the blue line is intraoperative hemodialysis group. And green line is not used. We have shown that intraoperative hemodialysis significantly reduces the post-operative azotemia in such cases. So we are trying to reduce complications through such ingenuity. Here, I'd like to share one simple case, but I think it's a good example and will probably lead to a better understanding of our procedure. This cute dog is a 12 years old spayed female Chihuahua weighing only 3.2 kilograms. She experienced a pulmonary edema several times despite diuretic use. So she's called stage D mitral valve disease, the most severe stage of mitral valve disease. So let's take a look at echo. This is a left ventricle, and here is a left atrium and the mitral valve. The coronary Doppler imaging shows severe mitral regurgitation here. The turbulent flow is very clear to see in the left atrium, and both ventricle and atrium is markedly enlarged. And you can see frayed anterior leaflet here, indicating the mitral cord is ruptured. And transmitral flow velocity shows significantly high velocity of E wave of 178 centimeters per second. This means very severe congestion in this case. So the life expectancy is limited to less than 1 year. And so we recommended surgical treatment and the owner agreed. This is our surgical team. This surgery requires at least 6 to 7 well-trained staffs. The main surgeon and main assistant and instrument assistant and perfusionist of cardiopulmonary bypass, anesthesiologist, and circulating nurses. The skill of these staffs greatly affects the operation time and operation outcome. So I should emphasize that the whole team is important. Just as a great baseball pitcher cannot win a match alone, so this surgery will be not successful with a good surgeon alone. So this is a movie we use for owners to better understanding of the process of the surgery. Please look at this movie. The 3 incisions are made: neck, chest, and inner thigh. The femoral artery and vein is used for invasive blood pressure measurement. The after-coagulation control by heparin. The cardiopulmonary bypass is started, and we approach to aortic root and cannulate for cardiopressure injection. Then the heart is stopped, and finally, we can enter into the heart from the left atrial incision. Again, 3 incision, and monitor the invasive blood pressure and heparinization and connected CPB, and cannulate the aorta and clamp the aortic root and perfuse the cardiopulmonary, and finally the left atrial incision. And this is a cannulation for the bypass. The dotted line is silhouette of the dog. The neck vein and artery is used for cannulation. The venous cannula is inserted to the jugular vein, and arterial cannula is inserted to the carotid artery. And this is a bypass circuit. The venous blood is moving to the venous reservoir, and then blood is gained its momentum by a roller pump. And roller pump is an alternative to the heart, and then oxygenated by the artificial lung, which is an alternative to the lungs, and return to the artery. And another roller pump is used for ultrafiltration as needed. And this case was also a good example of coda tendon rupture. So you can see that thick coda tendon near and are broken. This is an anterior mitral reflex. So reflex have some other codes, and the main code is broken. And breaking these thick coda tendinae often leads to a sudden onset of dyspnea and difficult to control with medication. Yes. We also evaluate other valves, but it seems that this is the only one that has ruptured. And it's our work to replace it with a new coda tendinae. Okay. This is a scene during the coda tendinae reconstruction. The artificial cores are non-absorbable Gore-Tex suture and durable and will never be a problem again. I will show the procedure in the next slide, and this photo, you can see the two artificial coda is already implanted, and the third one and fourth one is prepared. And we adjust the height of the reflex by using the nerve hook. And this is a schema of our procedure. A normal heart has a good coaptation of two mitral reflex. If the coda tendinae are broken, as in this case, the coaptation of the reflex is completely lost, and there is gaps for large regurgitation. This surgery consists of two procedures. One is the reconstruction of coda tendinae, And we can achieve an accurate quarter height adjustment by using Gore-Tex suture. But note that mitral annulus is still dilated. The other procedure is the suture annuloplasty. The mitral annulus tightened to an optimal size like this, resulting in appropriate leaflet coaptation. These two give a good valve function again. After surgery, the valve prolapse is corrected like this. This is a post-surgery. And regurgitant flow is completely resolved. The transmitral velocity is significantly decreased from 170 to less than 100 centimeters per second. And this is a good example of complete cure of this disease. The ICU care is also important. And sometimes harder than surgery. But this case, the vital signs are stable and that event have not occurred. You can see the patient is stay calm in the ICU cage. And actually, we had 2 mitral surgeries in that day. So 2 chihuahuas are in the ICU. The next morning, the oxygen supplementation was finished under oxygen saturation monitoring. And oxygen saturation is over 95%. So the 2 case is in good condition. And both 2 cases showed good recovery. And so chest tubes is monitored for the blood. The test tube is for monitoring the blood hemorrhage. In the intrathoracic hemorrhage is removed, and urinary catheter is removed, and invasive blood pressure monitoring is over in the next morning. And the 3rd day after the surgery, the 2 chihuahuas is a very nice condition. So no fluid treatment and no monitors at this stage. They are just waiting for the time to leave the hospital. The average time to discharge is 6 days after the surgery. Of course, the 2 dogs have no cardiac medication in that. And let's have a look at the results of the VCA Japan, our team, Shiraishi Animal Hospital, in these 2 years. And there was no intraoperative death and 3 intraoperative deaths, in hospital deaths. And discharge rate was 90%. And all of these dogs alive 3 months after surgery. And you can see some surgical results by the article in these teams. And this team is in Japan, the most oldest team. They had a 75% alive case. And these two team is by Dr. Uechi, is about 90% discharge survival rate. I think our result is non-inferior to others. And these are all Japanese facilities. And durability is also important. And this is an example. The one dog died 1.5 years after surgery due to hepatic cancer. And please look at here. The pledget and suture is still work, and its surface is completely covered with endocardium. So after the 100th year, the pledget and sutures are still work, and this endocardium cover is protect from the thrombus formation. The longest follow-up case is 2.5 years, but none of them have clinically problematic recurrence, which means no cardiac re-enlargement and no re-medication is needed. And in our longitudinal data, cardiac reverse remodeling was favorable, that LVIDDN and LAAO was already within a reference range 1 month after surgery. And good cardiac function persists long time after surgery. Of course, no medication rate was high, and the rest of case required sildenafil for residual pulmonary hypertension. So our data show the perioperative mortality is 10%. It's not inferior to others. And post-operative cardiac function is very good, that no recurrence was documented. The reference range is of LAAO is 1.6, and the reference range of LVIDDN is 1.7. So these two are below the reference range long time after surgery. And we had here's 12 months after surgery, but we have now 24 months after surgery is the same results. The post-operative critical care is very important. And here are many life-threatening complications, bleeding and failure of valve repair, coagulation abnormalities, heart failure, kidney failure, lung failure, and neurological disturbances. These complications is seen during the OP and ICU. And unlike general surgery, the thrombosis could be a problem because sutures are still in the beating heart. So we use antithrombotics for 3 months after surgery. Actually, the 2 dogs discharged 6 days after the surgery and doing well now. And in addition to the clinical work, we are doing the academic work. We are committed to sharing our knowledge around the world by the journal. This is a case of a rare complication of a metabolic alkalosis after the mitral surgery. This is the first paper from our team, and please read it if you are interested. The 11-year-old Shizu, the very critical case. That's interesting case report. This paper is already published in last month, and you can read it, but with some fees. The next one is very interesting and very important paper, the research article, Change in renin-angiotensin-aldosterone system profile during cardiac reverse remodeling after mitral valvuloplasty in dogs. This paper is accepted for publication by JVIM. So we showed renin-angiotensin-aldosterone system, which is elevated preoperatively due to heart failure and was decreased after 1 month and 2 months and 3 months after surgery. This is important data. So we conclude the post-operative drugs are not needed in that state. The last one is about the prediction of post-operative pulmonary hypertension. As I mentioned the previous slide, some cases need sildenafil for pulmonary hypertension even after surgery. The Dr. Yoshida, the part of our team, is doing interesting work. The new echo method of pulmonary wave refraction can non-invasively categorize the type of pH and can predict its prognosis. And this paper is accepted for publication by Frontiers in Veterinary Science. So we have some cases with pulmonary hypertension require sildenafil even after the mitral surgery. This is a problem. So we can predict the post-operative state of pulmonary hypertension by using the pulmonary artery wave refraction method. This is a non-invasive method by using thoracic echocardiography. So, thank you for your time and attention today. And now, the COVID situation limits our activities, but we will uploading activities on Instagram, and we can do some work overseas in the future, I believe. So please pay attention to our activities. And I can also receive questions by DM, and will answer as much as I can. Okay, thank you for listening.
Thank you so much, Doctor. It is incredible. We can only dream of doing that procedure here in Latin America. We hope that in the future we can. So while, let's see if the audience muster up some questions. In the meanwhile, I have a couple. I'm a cardiac enthusiast, so I really enjoyed the talk. Thank you so much. I was wondering, which and when should we suspend medication before the procedure in the patient? Or if we should suspend any medication at all?
Suspend medication.
Like the chronic medication that they have been taking.
Mm-hmm.
If we should stop it before surgery.
We stop the conventional medications such as diuretics.
Mm-hmm.
The day before surgery.
1 day, okay.
Yes. But some severe case, mm-hmm. we use these drugs the morning of the surgery.
Okay.
Yes.
Okay, thank you. Okay, okay, I have another one. Mm-hmm. Should patients that have a pre-operative azotemia, we know mm-hmm. that many cardiac patients suffer from renal disease, mm-hmm. should they go through some cycles of hemodialysis before mm-hmm. the procedure to reduce it, or is it not necessary?
Hemodialysis is have a risk, many risk of anemia.
Mm-hmm. Okay.
So the hemodialysis needs a bypass in some methods, so require heparins and anesthesia. So the hemodialysis is, I think, not need for these patients. So because the risk is higher than the benefit.
Okay, got it. Thank you. Okay, I have another one. It seems the audience doesn't have much questions, so I'm mm-hmm. going to take advantage. Okay. In the ICU, when you monitor the oxygen saturation, mm-hmm. is it measured invasively or is it just with a pulse oximeter?
Oxygenation. We use tail and non-invasive measurement.
Non-invasive measurement.
Yes.
Okay.
Like this.
Okay. We have okay.
They have the probe is on the tail.
Oh, okay. Gotcha. Let me take. Okay. We have a message from Dr. Carlos Luna Tortos. He is actually our supervisor of the annual encounter in our university. And he says, thank you for your conference, impressive work, and congratulations. We are very thankful. Okay, I'm so sorry. I have another question. Which patients are not candidates for surgery?
Okay, the age of the patient is very important. So we do not recommend over 15 years old. And when above the 14 years old, we strictly talk about their life expectancy after surgery. But below the 13 years old, we do not talk much about their age below the 13 years old. And
okay.
The renal function is also important. And this, in this case report, this patient had a creatinine of over 6, very high. But this case is acute renal failure, acute kidney injury. So the value is important, renal value is important, but if the patient state is acute renal failure, the kidney is not failed completely. Actually, the dogs have good recovery. The creatinine is now below the 1.0 now, and still alive without any arrhythmia now after over 1 year. So the value is important, is the renal value is not perfect. So the patient stage, chronic or acute, the renal damage is, so we don't have complete the perfect method, but we assume that predict the post-operative renal function by the cause of the kidney values.
Okay, thank you. Have you used cardiopulmonary bypass to repair other heart abnormalities, maybe like congenital deformations? Yes.
Okay, I have an interesting case.
Please go ahead.
I can show you some interesting cases. In this case, is a congenital, and we found the this is a 3-month-old Shetland sheepdog, and he had a third mitral valve leaflet here. This is an anterior leaflet and posterior leaflet, and the third one is here.
Wow.
Yeah, this is called accessory mitral valve tissue. And this goes left ventricular outflow obstruction, and pressure gradient is very high. The flow velocity is over 500 centimeter per second. And after removing by open heart surgery, the velocity is below 100. the outflow obstruction is completely resolved. And we are just a young team, and we want to experience some congenital cases like atrial septal defect or ventricular septal defect and others, but we do not have such a cases until now.
Oh, okay. Is there a low incidence in Japan of
Yes.
congenital defects?
Yes.
Okay. Okay,
So
got it.
we have many PDA case, so many PDA case, but not so many congenital other open heart surgery.
Yes, in Costa Rica, I would say that the largest incidence of heart problems is the mitral valve problems too. Okay, we have a question from Jose Vargas. He says that if patients post-surgery should keep physical therapy for the rest of their life expectancy, or any special care, which is also recommended to human patients in similar procedures.
Okay. Until now, we don't have the physical therapy staff in our team. Okay. So I think that's the weakness of our team. But until now, the patients getting well without these therapies. But some patients experience some illness during just after discharge from the hospital. So the physical therapy is, I think, good for these patients, but we don't have this experience. But in the long term, therapy is needed and is not needed. After discharge, after the 1 or 2 week, the owners say, my dog become younger, so exciting and a good activity after surgery. So they have a good condition after like 1 month after surgery.
So should they, I'm sorry, continue.
Okay. Please talk.
Should they limit exercise for at least 1 month after surgery?
Yes. After 2 weeks, I say they can walk around slowly, and after 1 month, they can go work as generally, and after 3 months, they can go to the very wide dog runs. They can do anything. Wow. After 3 months. We have no restrictions after 3 months.
Wow. Okay, great. They definitely get a second chance at life.
Yes.
Okay. If the audience doesn't have any more questions, we still have a couple minutes with the doctor. I want to personally thank you on behalf of all the 5th year students of the National University of Costa Rica. It was an honor to hear you talk. Thank you for accepting our invitation. And we would like to tell you that we are sending certificate of participation to your email in acknowledgement and in great thanks from all of us. And we hope to collaborate in the future. Have you come here and we go to Japan.
Yes. Okay, thank you.
Thank you. A la audiencia, muchísimas gracias por la participación y sigan atentos a nuestras charlas. Thank you so much, Dr. Matsura. Have a great day.
Thank you.
Bye-bye.
Gracias.
Con gusto.